I would like to talk to you about sacrocolpopexy. Sacrocolpopexy is the procedure to fix the pelvic organ prolapse. As you probably know from my other videos, there are different types of prolapse. They could be anterior prolapse or the bladder prolapse, another name is cystocele. There could be posterior prolapse or rectocele, or it can be apical prolapse when the top of the vagina or the uterus is prolapsing. So sacrocolpopexy helps with apical prolapse. This procedure considered to be a gold standard for the treatment of any apical prolapse. The reason being is that we can use a synthetic material that supports a prolapsing part, and that synthetic material is significantly more durable than your own tissues. So this procedure is safe for all women, particularly for young women who is physically and sexually active. Sacrocolpopexy can be performed robotically with the use of a robot, laparoscopically, or open procedure, meaning with one incision in your stomach. The traditional sacrocolpopexy was done when the uterus is removed. The synthetic material or mesh attached on one end to the cervical stump or vaginal cuff, and another side to the ligament close to your tailbone. The tailbone area, also called sacrum, and the cervix in Latin also called colpus. So that's where the name comes from, sacro, colpo, and pexy. Pexy means lifting up. So some women prefer to keep the uterus, and it's also safe and possible to do this procedure with leaving uterus in place. We also often remove fallopian tubes. If you're not planning to get pregnant in the future, you don't really need them. But by removing fallopian tubes, you're decreasing the risk of ovarian cancer by 50%. You can remove or leave the ovaries. Usually that decision is made based on a woman's age and personal preferences. In the younger women, it's preferred to leave the ovaries in place because they're still producing the hormones that are important for general health. And in older women, it's safe to remove the ovaries. In addition, some women who have a pelvic organ prolapse, they also have stress urinary incontinence or leakage of urine with physical activity. It's very common to do a sling procedure to fix stress urinary incontinence at the same time as you have your sacrocolpopexy done. Sacrocolpopexy is specifically just for the uterine or apical prolapse. If you had a hysterectomy, removal of the uterus in the past, it's still possible to have the top of your vagina prolapsed. And this procedure, sacrocolpopexy, will help with this type of prolapse as well. There are also two schools of thoughts in regards to removing the cervix versus keeping the cervix in. One school of thought believes that by removing the cervix, you decrease your risk of developing cervical cancer. The other school of thought is by leaving the cervix in place, you actually provide a great anchor point for the synthetic material. Also, by leaving the cervix in place, you decrease the risk of mesh erosion and also decrease the risk of injury of the ureters or vessel injury. In my practice, I recommend leaving cervix in place unless you already have a precancerous lesions in your cervix. So what to expect on a day of surgery? You will be asked to arrive to the hospital usually 2 hours before the scheduled procedure. In my practice, I usually perform these procedures robotically. So after routine preparations, the surgery will be performed through 4 to 5 very small, about half of the centimeter long incisions where the instrument will be introduced. It's minimally invasive and leaves very minimal scars. And if there are any additional procedures that are planned through the vagina or sling, they will be performed then. Procedure usually takes between 3 to 4 hours to perform, and majority of patients go home on the same day. Some patients stay overnight if there's any indications for observation. One of the important steps during your recovery in a hospital is to make sure that you're able to pee on your own. Some patients develop a lot of swelling in the area and just not able to void on their own in the first day. In those cases, we put a catheter and send you home with a catheter for a day or 2. And after that, I will see you in the office for a follow-up to remove the catheter. When you go home, You can walk around, you can take a stairs, you can take a shower next day. You can eat whatever you want, but just take it lightly because you still might feel nauseous after anesthesia. It's normal to have some bleeding and vaginal spotting, and when you void, you might feel a little bit of discomfort, which is also totally normal. Usually I give my patient Motrin and Tylenol to control the pain that they take on a regular basis, 3 times a day, and also some narcotics for the breakthrough pain. I found this regimen helps with pain the most and also decreases the inflammation and speeds up the healing process. In terms of the bowel movements, it's normal to not have a bowel movements for a couple of days after your procedure, but it's also important to start working on getting back into your bowel routines right away. So if there is a certain food that makes you go, make sure that you start eating that food. And I generally recommend to start Miralax every day. That helps prevent constipation that's common if you take narcotics. In general, recovery takes between 6 and 8 weeks, but everyone is different. General recommendation is to avoid heavy lifting or inserting anything in the vagina for that period of time while you're healing. And that includes tampons, vibrators, or having sex for at least 4 to 6 weeks. Everyone heals differently, and I will see you back in your office to assess how well the healing process is going. Usually, majority of women can resume sexual activity at 6 weeks mark. Every surgical procedure can carry certain risks. For example, risk of infection or bleeding or injury to surrounding organs and tissues. But your surgeon is well equipped to handle any complications, and you will be given preventative antibiotics before your surgery even starts. Some Sacrocolpopexy specific complications are: one is the mesh erosion. What it means is the mesh can protrude through the vaginal tissue. It usually happens rare, but if it happens, small erosion requires just a treatment with vaginal estrogen. But if it's larger, it might require an excision that can be done in the office. There is also the risk of the prolapse recurrence, meaning prolapse comes back. One of the common areas for prolapse to come back is anterior compartment or in the area of your bladder, cystocele. In my practice, I routinely lift your bladder, repair that area to ensure that that won't happen. In certain cases, even though the sacrocolpopexy is the most durable procedure, some people can develop recurrent prolapse at the top of the vagina. In those cases, there are other procedures that can be done to help fix it. But generally, it's very safe and gold standard procedure. Sacrocolpopexy can be a good procedure for your pelvic organ prolapse. Make sure to talk to your doctor to see if you're a good candidate.